insurance you subscribe to. If you are working for a government or a private company, the healthcare cost premium is deducted from your salary monthly. And in case of your self-employee, you need to pay to the local municipal government. So that's like a minimum monthly premium you need to pay. And then when you actually go to hospital for receiving some kind of medical treatment, that after the end of medical treatment, after you receive consultation from the physician, before you go back, you go to the counter in the hospital and they give you the receipt, like how much is your medical fee, which is automatically calculated based on what category you are in. Most of the population is 30% of the actual cost you have to pay. So that you just pay and then go home. That's how it works.
All right, thank you so much for the answers, Doctor. Now we will begin to hear the questions from Alvina Arista.
Oke. Sebelumnya mau nanya Mbak Aurel, suara saya masuk ya?
Yeah, yes, you're audible.
Oke, thank you.
I think I cannot hear her anymore.
All right, I think she's having some technical issues. Lina, can you repeat the questions?
Maybe with the question.
Now I can hear.
All right. Maybe to help her, because I think she's having some technical issues, I will help reading out the questions from the chat box. The questions is how to overcome health problems in aspects of economic governance and health aspects in Japan. Because in Indonesia itself, this issue is still often discussed and is a problem of inequality.
Thank you. Yes, it's an important and difficult question, but it depends on what kind of healthcare provision you are in mind. In Japan, there are so many different ways to support the people of low-income people. I didn't mention too much in this lecture because lack of time, but if you, for example, if your monthly medical expense exceeds certain amount, like in the US dollar worth maybe $500 or above, because you have had to go to hospital so much because receiving surgeries or taking expensive medication and so forth, then you'll be reimbursed later. It's not immediately, but after 1 or 2 months, the local government calculates how much expense you have paid and you will be reimbursed. So this is a system to try to support all citizens. Try not to go bankrupt by paying medical fees too much out of your total salary. So this is one social healthcare like a safety net system that is in place in Japan. And also for another like very low income group, there are other means to so that people are exempt from paying any medical fees. But this one, there's a bit of paperwork you have to do to be able to prove that you are have very low income and so forth. So there is a support from local government, like public health centers, needed. But there is a way to help all these people who are in low socioeconomic status.
All right, thank you so much, Dr. The answers to Alvina's questions. We will now begin to hear from Aisha Devani because she's raising her hand. So, Aisha Devani, you may have the floor.
Okay, thank you for the opportunity. Am I audible?
Yes.
Yes.
Okay. Based on Dr. Ayako's explanation and the presentation of the previous slides, healthcare and clinics in Japan are dominated by the private sector. And I just thought that the cost will be more expensive, right? And my question is how to manage the insurance for the healthcare from the government, considering that the demographics of the population in Japan are many people of elderly people that may be not working anymore, and maybe for people with low incomes.
Thank you. Thank
So
you
yeah.
for.
Okay, thank you.
Okay. I think one thing I need to clarify is that I don't know so much the case in Indonesia about the price difference when you go to government clinic and private clinics. But in Japan, as I informed in my lecture, regardless of whether you go to public or private clinics, the medical fee is not so much difference. That might be surprising to some of you who have not experienced, but because we have a regulation in Japan that clinics, regardless of government or clinic, can charge people depending on the type of symptoms or the type of medical services that the clinic or hospital provide. So this is one thing that is maintained, so that even though if you go to private clinics, the medical fee is not so surprisingly more than compared to when you go to government clinics. But of course, there are so-called out of medical, how do you say, system healthcare services. That's difficult to explain, but when you opt for like cosmetic surgeries or even cancer treatment, if you choose to receive a treatment that is not in the package of what the Japanese government designate as one of the standardized medical treatment procedure, then you need to pay 100% of that medical cost. So that, of course, adds to the cost of medical fee. So, but what I want to say is that because Japanese healthcare system is designed in such a way that it doesn't make people in difficult situation if you seek for healthcare. Basic fee for medical cost is maintained in a relatively lower price. It's controlled. I hope I answered your question.
All right. Thank you so much, Dr. Ayako, for the answers. I think we still have around 10 minutes left. So if anyone wants to ask more questions, I highly encourage all of you because as participants, you're encouraged to ask questions, to share your thoughts, and to present any relevant examples. As this is meant to be an interactive discussion between us and Dr. Ayako, so don't hesitate to contribute our insights here. All right, I will be counting down. 3, 2, 1. All right. That means the questions from Aisha Devani was probably the last questions for our sessions today. Before that, I would like to say a massive thank you to Dr. Ayako for giving us such an insightful presentations regarding to the healthcare access in Japan. As these sessions from the beginning, it has been promising to be an enlightening explorations of the Japanese healthcare system itself to unveil both of the theoretical underpinnings and contemporary issues that shape access to healthcare services in Japan. All right. I think it's since that we don't have any other questions here, we can begin the documentation sessions. So to everyone, please open up your cameras. I will begin to document it in 3, 2, 1. All right, for the second slide, 3, 2, 1. The third slides in 3,